Imagine you're in a desert. It's 3,000 years ago. A man lies bleeding after a fall from his chariot. Bones shattered, flesh torn. No anesthesia, no sterile tools. But what happens next will blow your modern mind. A priest steps forward. Not just any priest. He's the surgeon. With a blade carved from obsidian, sharper than today's surgical steel, he performs an operation that won't be rediscovered by modern science for another 2,000 years. Welcome to a journey into forgotten brilliance, where ancient civilizations defied science, challenged death, and performed surgeries we thought only modern medicine could do. You might believe that surgery is a recent human achievement, a marvel of the modern world with robotic arms, ultra-precise lasers, and computer-guided diagnostics. But what if I told you that thousands of years ago, long before antibiotics, electricity, or microscopes, some civilizations performed brain surgery, cataract removal, plastic surgery, and even dental imp. Today we're unearthing the secrets of ancient surgical practices so advanced they still leave modern doctors stunned. Let's start with trepanation, the world's oldest known surgical procedure. Archaeologists have discovered skulls dating back 7,000 years, with perfectly round holes bored into the cranium. The Inca civilization in Peru performed this routinely, with survival rates of up to 80%. They didn't have antibiotics or anesthesia, yet their patients survived. Multiple surgeries. How? They likely used hallucinogenic plants for pain and natural antiseptics like coca leaves and resins. Tools? Not crude stones, but obsidian knives sharp enough to slice between cells. Modern neurosurgeons admit the precision was incredible. Let's travel to India around 600 BCE. Here we meet Sushruta, a name lost to time until scholars rediscovered the Sushruta Samhita, a surgical manual so detailed it describes over 300 surgical procedures, more than 120 surgical instruments, techniques like skin grafting, cataract removal with a curved needle, nose reconstruction, rhinoplasty, for warriors or criminals who had noses cut off. In a time when the world feared cutting flesh, Sushruta wrote about cutting only when necessary, with tools of iron, not anger, with hands trained by years, not days. What's more impressive? He insisted on hygiene, washing hands, sterilizing tools with fire, and using natural antiseptics like turmeric. He even believed in surgical ethics, much like the Hippocratic Oath. Ancient Egypt is famous for mummies, but did you know they also excelled in surgical knowledge? The Ebers papyrus, circa 1550 BCE, mentions suturing wounds, fracture setting, even brain injury management. Egyptian doctors used copper scalpels, linen bandages soaked in honey and resin, natural antibiotics. Drilling for head injuries, likely to relieve pressure like today's craniotomes. They documented symptoms and outcomes, clinical records, long before modern charts. In Phoenicia, modern-day Lebanon, and ancient Egypt, archaeologists found teeth replaced by seashells, ivory, and even animal teeth, carefully carved and implanted in the jaw. X-rays show signs of bone integration, meaning these implants weren't just cosmetic, they worked. In China, gold wires were used to stabilize loose teeth, orthodontics long before braces. In war, survival demands innovation. The Greek physician Hippocrates wrote of chest tube drainage for lung injuries, rectal exams for diagnosis, and surgery only when absolutely needed. The Romans took it further. Military hospitals had specialized wards, tools nearly identical. Many of his texts guided Europe's medical schools for over 1,000 years. Here's what's astonishing. Even without modern drugs, they used willow bark, source of aspirin, mandrake and opium as sedatives, turmeric, myrrh, and honey as antimicrobials, even sponges soaked in wine and herbs placed over the nose to induce unconsciousness. Primitive anesthesia. Modern research confirms Many of these remedies had legitimate antibacterial and anti-inflammatory properties. If ancient people were this advanced, why did we forget? Invasions, wars, and the burning of libraries, like Alexandria, erased centuries of wisdom. The fall of Rome led to dark ages in medicine in Europe. Superstition replaced science, but the knowledge lived on, in India, in Arabic texts, in fragments. Modern medicine only caught up during the 18th and 19th centuries, rediscovering what had already been known. So next time you marvel at robotic surgery or laser scalpels, remember, long before electricity, long before X-rays, before microscopes and degrees, there were hands guided by courage, minds fueled by curiosity, and blades sharper than belief. Because sometimes, the most advanced surgeries are the ones buried in the past.